there. Today we're going to go over desktop applications that can be used for two-dimensional motion analysis. If you've seen my other webinars, you've noticed that I typically tend to talk about our mobile applications, which are really great for getting people into using 2D motion analysis in their practices, mostly because there's no cost to really get started, and they're really easy to use on the go. But let's say that you have been using video analysis for a while, or you're very comfortable with technology and you're able to see where this could be a really good place in your practice. So I'm going to go over clinical movement data specifically today, but we also have two other options, which are Pro 8 and dialed in motion. I'm going to quickly cover what those might have a place for in your practice. So clinical movement data, one of the strengths of it is really that it has a patient database and it allows for high definition streaming of a video in both planes, the coronal and the sagittal. So you can see both views, they're already sunk together and you don't have to sync them or anything. The other great thing is that they create really sophisticated, nice looking reports with two different interventions side by side compared. So we're going to go over that all today with clinical movement data, but look forward to our other webinars that may go into Pro 8, which one of the things that I love about Pro 8 is that you can record yourself conducting a video analysis. And then if you want, you can actually upload that to the cloud and use that to have in your discussions with your mobile analysis app. So there's some great features of using that because if you're trying to explain to a physician why you are making clinical decisions, you can do that within that application. And then what you can do is you can actually draw on it and speak to why you're seeing these, what you're seeing in your observations. Now, the third one is called dialed in motion, and this may be for clinics who are doing a little bit more of running analysis, or they may be fitting patients with shoes. This software allows you to compare 4 different types of shoes or interventions. So if you are maybe comparing 4 different types of AFOs, then you may want to use something along the lines of dialed in motion. Now, feel free to check those out on our website. You can see, you can get a link to them through the website. But today we're going to talk about clinical movement data and why you would possibly want to use a desktop application for two-dimensional motion analysis. So if you are on our website, you can come over here to products and you can go to clinical movement data. And it's going to pull up a few images for you to see, and we're going to go over those all today as well. But you can scroll down and you can also see some examples of some setups. So we provide software at PnO Data, but we can help you to get a video motion analysis lab started in your facility. So this image here, it is going to show you how we can help you to order all of the equipment, being 2 different monitors, 2 different cameras, a whole cart that allows you to really create a nice patient-centered approach to two-dimensional motion analysis. So what you're going to do is you're actually going to install the video cameras that would take the patient video from the coronal plane, and then you'd have another video that would take the sagittal plane. And what is happening is it's going to simultaneously stream those into the software so that they're already sunk for you when you want to review your videos. So it's a really sophisticated way to capture video of patients that are coming in and out of your office. And the patient database helps you to quickly pull up any patients that may be associated with a patient. So if you're not sure exactly what equipment you already might have or that you might need, we'll help you. We provide a hardware source, and we provide the list of all the hardware that you need. So you can actually order the hardware yourself, and we'll just help you, get it all set up. We can do that remotely over the phone, or we can help you set it up in your office, of course, and then do some training with that as well. So it just is depending on what you're looking for and how sophisticated you might want to get with your system. So let's just take a look at how we could implement some of the video analysis tools within our practice. So as I said, it is a desktop application, so it can be used with the mobile apps. And so you could actually take video with high definition cameras, and then you can process them and you can put them into the web-based software as well. So there's lots of mixing and matching that can happen to depend on whatever your workflow is for your practice. So I'm going to open up the clinical movement data software. So if I had a full gait analysis room and I had my 2 cameras set up, we would actually see when I go into the software, we would see both of those cameras coming into the software. I can't show you that right now because I'm actually using the cameras to record the webinar. So quick analysis is a feature that allows you to quickly get in and show someone what you're seeing. So let's just say you're working with a patient and you wanted to hurry up and quickly show them what you were seeing. You could do that here. So if I had a camera like me here, we could see that and we could take our video and quickly do an analysis and show the patient with all of our drawing tools what we're seeing. Now, I don't really like to use quick analysis though because it doesn't allow me to keep that patient information. So what I'm going to do is I'm going to finish here and I'm going to go back to my home screen. So on my home screen, I can pick existing client or new client. So if we did have a new client that had just come into our office, we could create them a client profile in our patient database. So that's pretty easy to do. We'll just go ahead and fill out some of their information, their patient ID and whatnot. But I'm going to go back to previous here or finish and go to an existing client. The reason I want to show you an existing client today is because this is where when you start to build up your patient database, that's when it shows you how powerful this could be if you've got a lot of patients coming in and that you're doing a lot of analysis on. So if I wanted to, I could search for the client name out of the last name and first name, but I'm just going to go ahead and pick my patient that's in my demo, which is Rory Tester. So we'll go ahead and click OK. Now, when I pull his name up, I get all of my previous reports that I've conducted, they'll pull up. So I can see, let's say, this was 3 years ago that I conducted an analysis, and this is my report that it would pull up so that I can see exactly how he's doing. Now I can also look at previous reports. So you'd see lots of different tabs here if you've done a lot of analysis on a patient, which is a really cool way to quickly see how the patient is doing. So we also have a button here that's called Review Videos. Because the software works as a patient database, when you take video of a patient, all of those patients' files go into one folder, so you can always quickly access any moment in time. So again, they're coming into your office today, they're not feeling very good about the way that their socket is fitting, and they're feeling like they're not walking very well. You can pull up a video from a year ago or 6 months ago and you can make some comparisons and say, yeah, actually you're right. You're not spending as much time on your prosthesis as you normally do in your steps. So let's take a look and see what we can do about that. So I'm going to go to next because I'm going to conduct a report or at least show you how we can do that. So today, because I'm conducting a new one, it asks me who my technician is, and I'll go ahead and click my name, and it asks me my assessment types, and it has a drop-down menu here as well. So I've got a POGS, which is the Prosthetic Observational Gait Score. That's all of our reports are based on those research-based methods, and the Edinburgh Visual Gait Score. Now, if I wanted to, let's say I wanted to conduct an outcome measure that is a sit to stand of a patient sitting to stand, and we're basically using a timed measurement. And I want every single clinician in my office to use that same template. I can actually make my own templates in our clinical movement data software. So that's another one of the cool things about clinical movement data is that if you do want to veer away from the research-based methods that say you even want to conduct an analysis or create your own method of conducting analysis, you can make your own template within the software. So, and then it would allow you to conduct a report and to create those reports and send them to physicians just like you would the other reports. So We won't get into the template editor and how that all works today, but just know that if you're ever interested in creating your own reports, maybe creating your own outcome measure and you want to test it, this is where you would do so. And that's one of the powerful things about it. Okay, so I'm going to go back and click Kara as my technician, and I'm going to conduct a POGS. Now, I can add a little bit of information about my patient, so pre-fit assessment notes that will be included in my report. Let's just say that he is complaining of pain. Oops. All right, so we'll just leave it at that. And then maybe some notes that will not be included in the report. We could, base this off of, let's say he has a Fitbit and we download that information and we see that his activity has actually increased. And so that might be something that that we might want to know. So patient activity increased. And we can put that in either or, the piece that will be included in the report, or maybe the piece that won't be included in the report. And then we will hit next. And this again is the screen that comes up that shows you me here because I've got a webcam. But if I did have if I had cameras, I could go to capture settings and I could use different cameras that I've got set up. Since I'm using my cameras for my webinar, I don't have those to show you today. But we have all of these different views of how we can capture our videos and use those for our analyses. Again, because we have the ability to stream 2 videos at once, we can put them side by side. We can put them in different views because of coronal and sagittal. We might want them in different views. So if we were conducting a report right now, or we were going to actually do an analysis, we would do start capture right here. So there's lots of different options for this. If you do purchase the software, this will all be gone over in more detail in training. So I will just click OK there. And what I'm going to do today is show you how we can do a pre and post fit report. So I'm going to take a video that I've actually compiled from the past, which has oops, that's the wrong one. This one is I'm going to use for that one. And then I can go and get my my videos from anywhere, which I'll just do right here. And then I'm going to pull my video of him in a different, there we go. So I had taken 2 different videos at one point in time, and I had compiled them to create one video. So it took the sagittal and the coronal and it compiled them. And now I want to compare it to a different instance, which again has a coronal and sagittal. So I'm clicking next here, and this is where my report is going to start to compile. But first I'm going to sync the videos. So they have been taken at different times, so I'm just going to quickly sync them to his heel strike on the prosthetic side. All right, and then we'll sync this one to the same. Okay, and then I have a screen layout that I can choose from here. And then it's compositing my video. And this is where we come to the pre and post fit video analysis. So there's a little tick box up here in the upper left that I'm going to click. And what that does is it allows me to fill out the report on one side and then fill out the report on the other side as well. So I'm not going to go through how to conduct a complete report. What I want to concentrate on is some of the cool tools that we have with the clinical movement data system. So, and how we can compile a report that shows us side-by-side comparisons. So one thing that you do have the ability to do with the clinical movement data is that you can scroll in. So if I'm using my drawing tool, I can scroll in. So a lot of people ask about the web-based software, if you can actually scroll in or zoom in, and you can, but it's a little bit easier on the desktop software. So let's say that we're making our first clinical decision, which is arm swing, and we want to take a look at how he's doing with arm swing. We'll just go ahead and push play here. And we see that he's doing pretty well with arm swing. So if we want, we can take an image capture. And then we just hit this clipboard here, and it puts that image into place for us. And very similar to the way that the web-based software works, we just use the drop-down menu, and we'll pick one of those options. And those will compile the different answers that we have chosen, and then I'll put that all into the report. We also have a component type, just like the web-based software does as well. So you can pick which components the patient is wearing. You can add for the previous. We've got, lots of different options that we can pick. And then if we want to compare an intervention, we would go over here and do the same thing and pick our different options based on what they are using. Okay, so let's go through and look at some of the tools that we have with clinical movement data. So I'm not going to show you how to conduct a whole gait score report because we've done that with the web-based, and it's very much similar. One of the only things that is nice to know about this is that you don't have to do a full screen capture. You can do just very, very zoomed in images. So let's say that we wanted to look at the first ankle rocker, and I just took that image of that. So we'll put that there. So you can get, some bigger images. And again, if you've taken high definition video, then these images can, be really, really good and clear for your report. So as I said, I'm not going to conduct the entire report, but I do want to go over a couple of the tools that I love with clinical movement data. One of them, and this is one of the best ones, I think, is this percentage of horizontal distance. So as we know, we're going to look at lateral trunk lean in one of our measures. So we're going to see how much he's leaning back and forth. So in this one, I'm going to use that percentage tool to see if I can make a bit better of a judgment based on my percentages. So first, I'm going to use my tool to draw a line through the center from the ground to his head. Okay, so we can already start to see that it's a little bit off. But now I'm going to use my percentage tool to really help tell the story. So he's got a little bit of, so what we're going to do is we're going to click on both shoulders, and then we're going to click on the line that's in the center and wait for my tool to catch up to me. So just hover over that line and it will eventually get there, I think. As a poor representation, but my computer's lagging a little bit. So then I can capture that as a screenshot, and I can add it into my report, which is lateral trunk lean. So I'll just go ahead and add that image there, and then I'll check that he is moderate to the stance side. So the percentage tool I just like because we don't have to necessarily calibrate and look at exact distances. We can quickly get an idea of if there's an imbalance with that measurement because we just quickly get the percentages rather than having to take the actual distance. Okay, so we've got other tools in here as well that I'll just quickly go over. So let's just say we're looking at his peak hip extension. So might want to zoom out a little bit. So I just use my scroll wheel. So if we're looking at his peak hip extension, we'll look on his prosthetic side. Then we'll wait until he's got initial contact on that side. And we can use our angle measurement tool. So I'm going to use this one just to show that you can use several angles all at one time with the clinical movement data. So I'll go from his shoulder to his hip to his knee. And let's say I don't want to use the large angle like I've got here. I hit the shift tool and it goes to the other side. So again, a little bit more sophisticated tools that we have with our desktop software. than we do with our web-based software, just because there's limitations with what we can do with the web-based software. So, and again, maybe I don't want to have that other angle in the back as well, so I can just go and hit shift and it'll go to the other side. So, and then I can even do one more if I wanted to, but that's a little bit much. So we will just hit escape, and that will allow us to only use those two angles. So I'm going to take an image of that, and we'll put that into our peak hip extension image. And then we can make that decision there. Okay, so those are some helpful tools if anyone's used the web-based software and you've gotten the large angle a couple of times. It can be a little frustrating because you have to actually stop and start over again. Whereas this, if you don't like the number that you're getting, you just hit shift and it will get the smaller angle for you. So that's a little bit about these tools. As you can see here, we've got a lot of different options of the tools, but those two, the percentage distance and the multiple angles all in one go, are my favorite ones because they do help you to get those measurements a little bit faster. So I'm going to go ahead and finish this. Like I said, if I was conducting a pre and a post, what I would do is I would complete my pre, and then I will scroll out, and then I can just click over here and I can scroll in over on this side as well. So I would go over to my post fit and say, okay, so now he's had his post fitting. He's got a new prosthesis with a dynamic response foot. Let's take a look and see how he's improved. And so I'll go ahead and just show a few images there. And again, we can take a look and see, okay, so let's just do the shoulder, the lateral lean, and see if he's any better. So I'll take my line measurement. I'll go through the center and see, okay, well, maybe he's not that much better, but you know, it's a starting point for a discussion about how he could do some improvements. So we'll go from one shoulder to the other and then go to the center again and just hover there and wait for your tool to catch up to you. And then if it won't, oops, then we'll take an image and we'll put that into our report. So that will go into the lateral trunk. Oops, we took a big image. So if we don't like the image that we got, we'll just go ahead and click our tool again. And we'll try that again. And we'll hit, and we get that better image. So we'll choose that he is pretty normal now. He's got a normal lateral shifting. So again, we'll just go through all of those measurements on one side. We've got extra information as well. The web-based software, the template doesn't allow you to add extra information as far as just making some observations free form and adding those to your report. So I'll go ahead and click finish so that we can see what this report would look like. So the database allows me to save the report and return to the client area, save it and return to the welcome screen, or just discard it. But I will definitely save it and return to the client area. Okay, and so now I see that I have 3 reports for this one patient. So we've got our fit report that we did from the very beginning. Oh, sorry, this is the report that we did today. So what we see here is that we've got nice images side by side. And I'm going to show you a better example because this was just one that I was making quickly today during our webinar. So I will pull up another one for you to see. So this report was done, oops, not that one. Okay, so this report was done, it was an Edinburgh visual gait score, and this was an actual patient. And so as you can see, the images come up and it allows us to see why we made a clinical decision. So we've got the decision was toe contact for the initial contact pre-intervention, and now she has heel contact. Then we go to heel lift. We see a delayed heel lift because there's no heel lift at all, and now we've got a little bit more normal of a heel lift. So again, those images can tell the whole story in their entirety. You don't necessarily have to have as much of a conversation showing a clinician or a physician, another physical therapist, what you're seeing with your video analysis. The images show it all for you. So that's the idea, behind PnO Data. Our belief is that, video is a great tool to use in your patient care, and why not capture some of those moments that you're seeing and that you're making observations based on your clinical decisions, and those are helping you make your intervention decisions as well. So these reports can really quickly tell that story to your other healthcare providers, your payers, and also the patient. This shows the patient, we didn't see any heel lift before, and now we're actually achieving one of those goals. So now I will open the floor for any type of questions that anybody has about the clinical movement data software.